Welcome to Perspective. I'm your host Sana Makbool, and in today's show we will be talking about the second wave of COVID-19 that has struck not only in Pakistan but also in the rest of the world. And we of course know that the positivity ratio is also rising. We've seen 2,000 cases daily in the past 6 days in Pakistan. We know now that the number of active cases in the country has risen to more than 32,000, and we've seen the second wave coming in with more number of infections rising every day after about 4 to 6 months in Pakistan, where we did see a rise of coronavirus pandemic in the first place. And of course, we're going to see what the government's measures are in view of this second wave. What is the government deciding on matters of educational institutions in particular? And then, of course, on matters of marriages and wedding halls and outdoor gatherings, restaurants, and other such measures, and whether or not timely decisions are being taken this time around, and whether or not lockdown measures need to be put in place. We also know that the WHO has recommended and expressed concerns over the closure of schools, saying that they are supposed to be the hotspots of transmission of COVID-19, especially this time around. So we're going to see and analyze what the government's response has been overall up till now, and what needs to be the measures that need to be taken in light of the second wave. And we will also be discussing what is going to be the response from the people and the community at large, and how much are the people responsible for making sure that they contain the spread of COVID-19. To further discuss all of these issues, right now we have with us in the studios Vice Chancellor, Islamic University of Bahawalpur, Internet Professor Dr. Athar Mehboob. Thank you very much, sir, for being with us today.
Thank you. Welcome.
So, of course, one of the biggest concerns of coronavirus currently and its spread in Pakistan at the moment seems to be the fact that educational institutions have a lot of positivity ratio, and not just the fact that the students themselves may be able to get infected by COVID-19. They are the huge carriers, and they're responsible to potentially be spreading the virus back at home, their families, and the community at large. Being part of the educational sector yourself, how important do you think it is currently for us to take this decision into account, and what sort of factors do you think are played? Do you think it's so simple to just close schools and universities?
Well, in our particular case in Bahawalpur, at the Islamia University of Bahawalpur, after a very prolonged closure due to the first wave of COVID-19, we eventually opened the institution at the beginning of October. And then while doing that, in order to keep the density of the students low on the campus, because on our main campus we have 28,000 students, so we divided them into groups. And some of the students would come on certain days of the week, and some of them would come in certain part of the day. So we ensured that at any given time we won't have more than 4,000 to 5,000 students on campus, and we have a huge campus. It's 1,300 acres.
Right.
So that would ensure physical or social distancing between the students. However, somewhere in the early part of November and end of October, the second wave started coming. And this time around, the second wave, it struck the southern Punjab region in a more aggressive manner. During the first wave of pandemic, the Bahawalpur district and the Bahawalpur division did not have as many cases as other parts of Punjab or the country. But now in the second wave, what we observed that the virus was more deadly, and a lot more people were getting infected. So as a precautionary measure, after the announcement by the NCOC a couple of weeks ago, they did recommend the closure of educational institutions as a preferred strategy. And because many of the parents, they called us and expressed concerns. So we then converted the university about a week ago into a completely online mode of education delivery.
Okay, we'll talk more about that and whether or not we should be switching to an online mode altogether. Of course, the world is moving and changing, not just in light of COVID-19, but of course otherwise as well. And whether or not this is a viable way forward, and if it helps us as a community, why not? We'll talk more about that. But before that, let us introduce our guests who are online with us, and they have joined us in the show. Thank you very much. First of all, I'd like to welcome Chairman PM Task Force on Science and Technology, who's also the former Federal Minister on Science and Technology, Professor Atar Rahman. Thank you very much for being with us, sir.
Thank you.
And we've also been joined by infectious diseases expert, Dr. Ijaz Khan. Thank you for being with us, Dr. Ijaz.
Thank you. Thank you.
Right. First of all, I'd come to you, Professor Atar Rahman. Of course, we've seen the fact that a lot of measures by the government that have been taken since the pandemic started last year have been in line to making sure there's a balance between lives and livelihood. And our initial strategy of smart lockdown and making sure that the economy also keeps on running has been successful. But now that we are in the second wave, perhaps different strategies need to be taken into account. We need to reconsider all the measures that we've taken before and whether or not they're still applicable or not in the current scenario. So far, the measures the government has been taking, and with particular regards to educational institutions as well, do you think that we are on the right track?
Yes, thank you. I do think that we're on the right track because they are monitoring the progress and the spread of the virus on a day-to-day basis, and they are taking decisions about which areas to lock down or which areas not to lock down. There are about more than 4,000 areas in this country which are presently under lockdown. And so this has been the right policy so far. It has paid off. The difference now is that in this second wave, this virus is indeed more deadly. We have within the University of Karachi, with which I am associated, the International Center for Chemical and Biological Sciences, with excellent facilities for genetic analysis. And we have done the genetic analysis of this virus, the various strains of virus, the various samples. We have done 48 such analyses of 48 different genomes of viruses, and found that the virus has undergone mutations, and we have discovered 109 unique mutations. This is like a long molecule. It's like a necklace with about 30,000 beads added onto it, each bead representing a molecule. So it has got changes at a number of points, and it is constantly mutating. And what is the most worrying aspect is that the most prevalent strain is the one which is the most deadly one, and when we compare with similar strains in the world, and it is causing death very quickly, and it is also very aggressive. So this work has recently been completed at the University of Karachi, and this confirms the deadliness of this and the aggressiveness of this virus now.
And this particular strain that you've been talking about, that is deadlier, as you say, and is causing more deaths than before, do you think this is a strain that is currently spreading in the country?
Yes, indeed. Out of 48 samples, we found that 25 of the samples, when we did a complete genetic analysis, had this particular mutations, which are causing the aggressiveness. They cause disequilibrium and finally death within very quickly. And this is the one that is spreading, and that is why we have to be all the more careful in terms of precautions and social distancing, etc., because this wave is indeed scientifically proven by us to be more deadly than the first wave.
Right, this is interesting that you say this, and as you say, this is new research that you've just conducted, and these new findings that you found out, because so far as I know, and where my knowledge is concerned, we know the fact that before that we were talking about the fact that maybe no mutations have occurred, and that there has been no change in the virus since before, and this is only happening because of people's carelessness or them not making sure that the SOPs are followed. And it's interesting that you say that now that the virus has undergone mutations, it's a completely different scenario. I'd like to involve Dr. Ijaz Khan in the conversation as well. Dr. Ijaz, what do you have to say about the fact that mutations have existed and the virus is different now than it was before, and it is far deadlier? Earlier, what we knew was that that was not the case, and it was just because there's a second wave of the virus and that people are not being careful enough. But do you think that this is true, that we are experiencing a different virus at the moment?
Thank you. No, I think what we're seeing is a huge surge of cases now. Whether it's deadly or not, I cannot say because I'm not an expert on the genetics of that. But what we have been witnessing is that, and also documented, that there is, of course, mutation that has been documented. Whether that translates into the outcome or not, whether you can link it or not, I'm not very clear about that. But
okay,
you're right that we are, Dr. Tawarman is quite right that we are seeing a lot of cases, a lot of admissions, And of course, now deaths have started to rise, just like we had it before, actually. So if you call all our colleagues from different hospitals and ICUs, they are almost in the same level as we were in the peak of the wave, the first wave. Uh, so my take is that yes, we are seeing a huge surge, a huge second surge, and we probably will see a bad. We're looking at a picture which will probably get worse with time. So we have to take the initial measures that we took in the beginning, making sure that we save lives, and of course that is by using preventive measures, precautions that were reinforced. We already know that, and we just have to go back to the basics first to prevent this from spreading further by taking effective measures just we did last time.
Right, and Dr. Ijaz, just for our viewers' knowledge and to make sure that people understand what we're talking about, when we say the second wave of the virus or any virus, not just COVID-19, what do we really mean when we talk about the second wave of the virus coming and the resurgence of the coronavirus infections coming? What does it mean?
See, this was already predicted that some of the pandemics that have happened in the past as well, it will behave like that. And it's almost behaving like that is being witnessed in a lot of countries across the globe, actually. So we saw a very slow rise initially when it started in Pakistan, and then we saw suddenly a first wave surge, and then we had very uh, virus seems to have been under control, and you're seeing almost less than 400 cases a day across all of Pakistan, or even less than that. And the hospital COVID beds were empty, the ICU were closed, and even the death rate came down. And then whether this new wave that has come up, because the cases started to rise in many different parts of Pakistan, especially in some provinces and some cities, the cases suddenly jumped to almost uh, more than 2,000 cases per day from about 400. So that's a huge, huge increase,
We have a
almost
5.7
500%.
positivity ratio, which is huge. We were earlier
Yeah.
talking about a 2% being very high, but now we're at 5.7.
Yeah, absolutely. And the positivity rate went up. We are seeing a positivity rate from different hospitals, labs they are reporting. So that's what we mean by surge, that cases have risen
Right.
dramatically
Okay.
and also positivity rate.
Right. Okay. Dr. Azhar, we were earlier discussing the fact that you were giving your own examples at the university and what sort of measures you've taken and the SOPs that you've followed. But it seems that when we were talking about lockdown even before in the first wave, and we were talking about measures such as closing down of schools or extending vacations, there were different opinions in the general public of whether or not it should be done. How do you think, in your experience, the students or the families or the parents have they have taken, or the staff even at the universities and schools who work there, what has their opinion been like mostly in terms of whether or not these are necessary measures and whether or not they're more accepting of the fact that this is what needs to be done to contain the spread? How has the public reacted to these measures and what are they in favor of?
Okay, as you know, the first wave did not affect Pakistan as much as it was expected, or the worst case scenario did not turn out to be. And as a result of that, there was a lot of pressure on the universities, like our university, from the student body, to open everything up and go to a normal way of working.
Yeah.
So we did that while observing, the conditions set by the government to keep the density of the students low. But as we have found out that it is very difficult to force a large number of people to comply 100% with the standard operating procedures. And when you have a large number of young people get together, and because of the other conditions, due to the change of the weather, the other influenza viruses, they are also very active.
Right.
So it's a time of more vulnerability. And as it has been established that the second wave of the virus has mutated and it's more deadly, so I think all of these factors, when combined together, they have resulted in a preponderance of this second wave.
And you know, we're talking about university students, but when you look at little children and primary school students, it's even harder for them to make sure that they follow the SOPs.
Exactly, and this time around, I think in the second wave, the anecdotal evidence suggests that the younger people are being affected more, while in the first wave it was thought that the older population is affected more. This is what we hear from the people generally.
Right, and the fact that we're moving on to distance learning, as we were talking about earlier, you've done that in your university. In the rest of the world, also a large part is following this particular system, and that became the sort of the norm in the first wave. What was going on in the entire world, even in Pakistan, even younger students who had not experienced that before were following that. It seems to be that there is a reluctance of going back to that method, even though it seemed to be working fine. How do you think that the people are reacting to the fact that they'll have to move to digital learning back again? Is that not a viable method of teaching or learning?
I personally think, based on our own experience, that the use of the digital technologies can very well compensate, combined with the fact that we have already got about 9 months of experience. We have been taking examinations online, so much so that the BA, BSc examinations of students that the university conducts for the affiliated colleges, this time around we conducted those examinations online for about 25,000 students over a period of 3 weeks. And those are actually college students going to other colleges. So I think that the population can cope with the electronic delivery of education. And in those cases where there is some laboratory work, then a few students can be allowed to access physical facilities in a very controlled way. And this is the only way I believe that is there to ensure that we don't have the worst case scenario in Pakistan, because we have a very high population density, especially in the urban areas. And the university campuses, I would feel it is better to be safe rather than sorry.
Right, of course, absolutely. And that is the way, in fact, to contain this pandemic even today. And the precautionary measures and SOPs that are in place are for that purpose. Of course, we also know that the fact that we see contradictory responses not just limited to the general public. We've seen that before also earlier when we were dealing with the pandemic last year, that we had different responses coming in from all the provinces as well. So there were different ways of dealing with it at the government and the federal level as well. Even now we know that the Sindh Education Minister had earlier said that there was no question of winter vacations, and we know that the final decision is going to be taken on the 23rd of November, but we do see that the consensus had not been reached about this matter as well. Professor Ataur Rahman, considering the fact that we're looking at the spread of COVID-19 and the positivity ratio on the figures, and we see that this is a real problem that we're dealing with now, and we need to take measures that we haven't been taking for the past 4 to 6 months now. The fact that we do need a consensus on the national level, and for the different provincial ministers to also follow and be on the same page regarding not just education institutions but other measures as well. Do you think that we are sort of moving towards a unified strategy and trying to get that consensus in, because that is what we were lacking earlier as well?
Yes, sir. Well, firstly, I'd like to respond to your earlier point about distance education and the introduction of blended learning, if I may. I think this is a wonderful opportunity for Pakistani schools, colleges, and universities, which has opened up, because the single biggest problem in ensuring quality of education is the quality of faculty. And the fact that, for instance, in universities, we have only about 15,000 PhD level faculty members, whereas for a ratio of 20:1, we should have about 75,000 PhD level faculty. This can be greatly compensated by access to some of the best faculty members from MIT, Stanford, Yale, University of California, completely free of charge. There are excellent courses available in MOOCs, massive open online courses from all these universities. And in our schools, colleges, and universities, at the school level, you have the Khan Academy courses. So we must all try to blend these courses, to integrate them within our normal teaching system, so that the students can start learning from the best minds in the world, and this will help them to leapfrog in terms of quality of standards. Coming to the point that you asked about the necessity for all the provinces to work together, I think the biggest hurdle has been the 18th Amendment. The federal government can only make suggestions and the actual implementation comes to the provincial governments because health is a devolved subject. And that means that some provinces may follow what the federal government is saying and others may not. So it's extremely important for us to set any political differences aside and for us all to act in unison towards developing a common strategy to fight against this virus. And there are some things that we can do together very easily. For instance, what the federal government should do is that if you, in the first wave we saw that the airlines, you had to sit at one seat distance. There was one empty seat and only then people were traveling. Now everybody is packed together, jam-packed, and they're traveling together. So this the federal government can do easily. Secondly, we see people walking around without masks in large numbers, going to shopping centers, etc. So one should start introducing some fines and make it so that at least symbolically people become aware that if we don't wear a mask, we're going to be fined. Thirdly, they should and they are doing this already, to very carefully look at any areas where there is a certain level of cases beyond a certain minimum threshold and quickly lock them up and keep them locked up for at least 2 to 3 weeks so that the virus dies down. These and a whole series of other measures can be taken. But let me also clarify the point that I made right in the beginning. The first wave that came, we did the genetic analysis, and indeed the virus had already mutated at 8 points in its structure as compared to the original Chinese Wuhan virus. So even in the first wave, but these were inconsequential mutations. In other words, they were not mutations which would cause too much aggressiveness. The mutations that we are finding in the second wave it is the same virus, but it is just the viruses normally change their structure. It's quite common. They undergo mutation every 2 to 3 weeks. So this behavior of this virus is not unusual. This happens, except that now in the second wave, it now has mutated at points which have consequences in terms of aggressiveness and in terms of the number of deaths that it is causing. So we have to be extra careful, and we all have to work together in unison to fight against this menace that we are faced with.
You're absolutely right, and the measures that you have mentioned are extremely important, and most of them have already been put in place, and considerations are being taken in terms of these SOPs. What remains, however, is the fact that there is check and balances, and that, of course, that the implementation is ensured in different places, and the local authorities are very important in this regard. Another question that I'd like to ask you is that, considering the debate that you were earlier talking about distance learning and its benefits, I would also like you to tell us whether or not this debate that's going on currently at the moment, where we haven't really seen a decision coming out from the NCOC of whether or not there will be school closures. Where do you stand on that? Are you of the opinion that we need to do that right now? We need to shut down schools straight away?
I think they should be selective. Those schools where you see the infection should be immediately closed. Those schools where the infections are not there should be allowed to function. So we should be selective. Just closing down the entire school system or university system indefinitely is not the answer. But very rapid reaction to closing them down is indeed what is needed, so that there is no spread of the viruses from those institutions. And the same applies to marriage halls and to colleges, universities, departments, etc. Fast action to close them down, and then keep them closed down for at least 2 weeks before reopening after disinfecting the facilities. So this has to be done on a regular basis, and that is what the NCOC is trying to do, is watching every day what is happening and trying to take action as and when needed.
Right. Dr. Ijaz Khan, considering the fact that, of course, we see that it's very important, and the government has also been doing that to keep a balance between livelihoods and lives, and we've seen that a lot of people who do actually need to come out and work, and then, of course, the education sector is of utmost importance as well, and there's a lot of emphasis on making sure that it carries forward, and only those schools be shut down which are being seen as hotspots, and only those places be locked down which have a larger number of coronavirus cases. There is still a lot of misconceptions regarding testing of coronavirus, regarding whether or not somebody who has symptoms is the only one who's going to be positive. There's a lot of misunderstanding regarding asymptomatic cases of the disease. I feel even though we've crossed about a year in the pandemic, there is still a lot of conceptions which are not understood by the larger public as clearly as there should be at the moment. One such thing is the incubation period of the virus. A lot of people who do come in contact with somebody who is COVID positive seem to just rely on the PCR test, whether it's negative or positive, and will not go through the quarantine period of 14 days. Do you think that is okay?
Yeah, I think that's you are right. So I think I just allude to one point that of course in the second wave we cannot afford closing all the system again because of economy is being affected with all of that, the hospitals especially, the businesses. As far as testing is concerned, you're right that just like in the first wave that we saw, the testing is of course not optimal that we wanted. The test results are almost the same. The testing numbers are the same. A lot of asymptomatic cases and a lot of undetected cases who have mild symptoms, they will of course be the big one of the big things that spread the virus and helps in its transmission. So more testing is the answer, I think. The asymptomatic cases, of course, is a big challenge. If you are in contact with someone who has got proven COVID, then of course those individuals should take precautions, especially when they're going out, when they're intermingling, when they're socializing. They should make sure that they wear masks, take all the precautions to make sure that they do not spread, because they can be one of the super spreaders that I would say, especially in children. It has been documented in some studies at least that the children are more likely to spread. Certain studies, of course, refute that. So you are right that more testing is the answer, but of course, given that we do not have the resources, testing is limited to certain cities and institutions only. And that is a big challenge in the fight against this pandemic.
Right, and Dr. Ijaz, now that we're moving towards globally towards the production of vaccines, and we've seen a number of names also spring up, and a lot of them are talking about how their vaccines are doing well in the later stage trials, and we've even seen 90% effectiveness being quoted. There also is discussion going on regarding the fact that if we are able to immunize about 2/3 of a population, we might be able to achieve what they call herd immunity. Do you think that's applicable, or that this is miscalculated?
I think vaccine is, of course, going to be one of the big armamentarium that we are going to use against in control of this pandemic. But alone the vaccine may not be enough, because remember that these vaccines that are coming up so fast, it is unprecedented that so many vaccines are being developed just for this pandemic alone. And they went through a very rapid phase of trial to make sure that they are made and available for the people to be rapidly used. So there are still going to be a lot of questions. How good the vaccine will be? We know some of the answers are coming up. How long will they last? How many doses are going to be given? Whether you need to revaccinate down the line or not. So these are questions that are being answered as we speak. And so vaccine, of course, I'm a good, very strong advocate of vaccination as a control, just like many other diseases, infectious diseases that we know are being controlled by vaccination. And Pakistan will benefit from this vaccine, of course, because we do not have the resources to control this pandemic beyond the mitigation measures, the public health general measures that we talked about. So currently Pakistan, there is currently a vaccine trial that is going on. We hope that this Chinese vaccine will probably be one of the big things that we are going to see. Dr. Ataur Rahman the other day, of course, she talked about the Moderna and the other vaccine, the Pfizer vaccine. but they are not suitable for Pakistan. So the Chinese vaccine and some of the other vaccines that are coming up may be the answer.
Right, you're absolutely right. It's extremely important. All the factors that you've mentioned, and the fact that whether or not it's going to affect a particular population with the same sort of effectiveness, would it be okay for different people of different regions? And there are many other questions also, including the fact that will people even be accepting of vaccines? We've seen that, of course, in Pakistan, we are still facing issues with the acceptance of polio drops, and we are one of the two countries who's still facing polio at the moment. And with the fact that we are in a different sort of pandemic that the entire world is struggling with, this is going to be a big question for the Pakistani population to making sure that they are able to access coronavirus vaccines. Right, and the fact that, of course, there are a lot of people still, unfortunately, do not even adhere to this idea that there is even a virus in the first place.
Yes, many. A large number of the population considers it a conspiracy theory. They don't believe that the virus actually exists. And same thing for the vaccine. How many people would be provided the vaccine? Would it be affordable? Would it work? And the cases of recurrence and the mutations that are happening in the virus, would the vaccine really work for our population? So these are many of the questions, and how quickly we can vaccinate the entire population. As we have seen with the coronavirus, that our knowledge and understanding of the virus, the symptoms that it causes, and the treatments, the plethora of treatments that there are, the traditional remedies and then the vaccine. So it is very unpredictable how the future goes. So I would most respectfully differ with my fellow colleagues, and I would say that the best strategy at this time would be to have a strong lockdown for a period of 4 to 6 weeks, so we go through the second wave and survive the second wave. We have already suffered a lot of damage in the first wave economically, but we might have to do this for the second wave because it's so deadly. And for many cases,
also because people may not be as responsive as we want them to be.
Yes, we can't respond as quickly. Even in cases like our universities, we have students in the hostel, and if we keep them in the hostel, they will transmit the disease to each other. And it will, if some students are living in the hostel and we are not able to lock down the whole institution, then we can't guarantee. Earlier we were thinking about locking down a department. We did that for one department, then another department, but then it looks like it's a musical chair of departments that you keep closing, and you can't focus on your objective of delivering the education. You are more into the pandemic control rather than delivery of education.
Right. So right, and these are of course real issues, and you understand because you face them on a regular basis and you see that. And even on a larger scale, we see that it's so hard to make sure that people are actually following the SOPs. We're still living in a country where we have the opposition parties throwing jalsas and there are no SOPs being followed there, and we see a large number of people gathered. Even in small clusters, even at homes within residences, there was an entire report that came out that the fact that people sitting at dining room parties are causing a lot of huge clusters, which are actually contributing to the spread of the disease.
Exactly.
And these are things which are very harder to control. But then it also boils down to a communal responsibility. Is it not also on the people to make sure that they are able to make themselves and their families safe? How much of it can be relied on the government?
Exactly. This is the most important thing. And in a university that I established in Rahim Dar Khan, we had a mandatory course on basic health awareness, where the students, all the undergraduate students, were compulsorily given a course where topics in health like nutrition, epidemic control, and various other topics like awareness about drugs, they were taught to the undergraduate students. And we need to increase the health education level of the general population, and the universities can play a definite role in that, coupled with the health professionals and the hospitals. The consultants can come over and deliver lectures, so our students become aware of real health issues and how to control the spread of diseases, and how the disease affects the human body, and in cases of epidemics and pandemics, what is the responsibility of each citizen. So we need to have a social change, and this must become part of public health policy.
Right, it's extremely important. Professor Ataur Rahman, first of all, your thoughts on the issues of vaccines in Pakistan. We know that the Prime Minister has allocated about $100 million for this purpose. We don't know for sure what the cost is going to be for COVID-19 vaccines, but there's so many other issues surrounding vaccines and its use in the country. Do you think that there is work being done in this regard, or are we waiting for this till the last minute?
Well, what is happening is that there are about 150 companies in the world which are developing vaccines. About 10 or 12 companies are either completed the phase 3 clinical trials, which is the last phase, or are on the verge of completion. Two of these companies, one is called Sinovac and the other is Sinopharm, Chinese companies, are carrying out these trials. One is being done in Islamabad through the National Institute of Health with other hospitals, and the other is being done with my institute in Karachi, the International Center for Chemical and Biological Sciences, in collaboration with Indus Hospital. And these vaccines are much more suited than the Pfizer vaccine, which created some excitement recently, because the Pfizer vaccine requires a cold chain, minus 80 degrees centigrade, for keeping, for transportation, and it requires 2 doses. So it's all right for European countries or advanced countries, but in the developing world, we don't have that cold chain transportation system existing. For us, these vaccines, which are not RNA, messenger RNA vaccines, but they're based either on weakened virus or on the surface protein structure of the virus, which can be stored at minus 20 degrees centigrade and transported very easily across the country, are much more suitable. So I'm very hopeful that we will have some vaccines available, but this will take, before they become available on a large scale, it will take 6 to 8 months. The government has done the right thing by making money available. I would in fact go farther and advise that they should use the health card system in KP. They should introduce it across the country and subsidize it with the money that is available, so that people have free access to the vaccines, irrespective of where they are in the country. So the KP system of health cards should be replicated and used for access to vaccines across the country. And we have arrangements with China, with these two companies, that they will provide these vaccines at reasonable rates and in large enough quantities for Pakistan. So, but still we have this period of 6 to 8 months, and there is no medicine available, no vaccine available, and the only answer is social distancing.
Right, but considering the fact that whenever we do get the vaccine, setting aside money is one thing, but do we have a plan in mind? Do we have efforts in place regarding how accepting the population will be? How are we going to make sure that it's available to the larger sections? How are we going to prioritize healthcare workers, perhaps, or the poorer segments of society? 6 to 8 months for a plan is maybe not that long.
Yes, you are absolutely right. So we need to be very well geared up to be able to deliver the vaccine across the country. Of course, the acceptance of the vaccine initially, just like the polio vaccine, may be a problem in some regions. But by and large, I think people will be more than willing to use this vaccine that comes from China. And also, if the funds are available, and if the Chinese companies can manufacture this in a timely fashion in a large enough scale, then I think we will be able to tackle this. By the end of next year, we will have the whole situation under control if the vaccine can be available. And the herd immunity that you were talking about is something that we should not aim for, because that means along with that comes the death of a large number of people, because a certain percentage of infected people are going to die. So we should be trying to control it before the herd immunity situation emerges.
Right, we're short on time. So Dr. Ijaz Khan, my last question will be to you. Considering the fact that we're moving towards vaccines and moving towards the fact that we're going to go ahead with this in the rest of the world also, not just in Pakistan, this is of course the viable solution for any virus or any sort of disease that we see in the world. But as Professor Ataur Rahman was speaking earlier, that it's still a long time for that to actually happen and make sure we have access to all and they have this vaccine in place and they're accepting of it and all of those issues. By then, a lot of time would have passed, and we are still at the moment undergoing the second wave of the coronavirus situation. So currently, the measures that the government and the people need to take in that mindset, how would you conclude what we've discussed today?
I think Dr. Ataur rightly pointed out that we need to go back to our basics. Of course, that mask, hand washing, and of course social distancing. That's what we need to do. Vaccine, we already are into a critical phase, for especially for Pakistan. Alhamdulillah, first time phase 3 clinical trial is being conducted. I am one of the principal investigators at Shifa, and I know that the biggest challenge that we will see down the line, of course, is that the misinformation, disinformation that you alluded to earlier on, that people will always have these questions. And I'm getting calls every day. Most of them are positive. They want to get vaccinated. They want to get information, and we try to get the information. But there are a lot of other things that they say they will. Uh, uh,
We
of
talk
course,
about the
as you
coronavirus and the COVID situation a lot. Do you think we're still lacking about the awareness that is existing in the larger population? Are we still not doing enough in terms of what the media can do, what the government can do, in making sure that the people are aware? Because we are going through a pandemic and we seem to be talking about it a lot, but still there are many people who are of a completely different opinion.
I feel that we still need to do a lot. We are already doing it, but I think we need to double our efforts to make sure educate our masses, especially with regards to general hygiene conditions, general prevention measures that we already talk about, because that's what we need to change our behaviors, need to have better communication strategies, need to have better, make sure that we reach everyone, make sure that we educate more, especially the doubters, the people who still doubting whether this virus exists or not, whether disease exists or not, and of course down the line about treatment. There's so many disinformation about treatment, of course, that we already know in the first way that we saw about it,
Absolutely.
and of course now
Thank you.
vaccination.
Thank you, Dr. Jaz Khan. Unfortunately, we've run out of time. Thank you very much for being with us, Professor Ataur Rahman and Professor Dr. Athar Mahboob. Thank you very much for joining us in the studios as well and being part of the discussion. Well, you heard what we talked about today. Of course, at the end of the day, whatever measures that the government can take and whatever things that are happening in the world, they're extremely important. But it boils down to the fact that we need to make sure that we're taking all the preventions and all the measures that we need to be taking on an individual and communal level, and then move on to other shortcuts that we keep looking at. So that is the hope that we see, and hopefully we will be able to come out of this pandemic very soon. But it all comes down to whether or not we want to and whether or not we'll make an effort towards it. Thank you very much for watching. It's goodbye.